Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. This week we're going to be talking to you about a real painful condition called plantar fasciitis. Have you ever gotten up in the morning and as you're walking out of bed, you experience this severe pain at the bottom of your foot? Well, that pain is called plantar fasciitis, and it's an inflammation of the soft tissue under the foot and can have many causes and a lot of different treatment options. This week, our medical director, Dr. Michael Marciello, is going to be talking to you about the innovative treatment options that we have for plantar fasciitis here at Maragal Medical. Take it away, Dr. Mike.
Plantar fasciitis, wow, what a painful foot problem. It's so common. We see this all the time. So many of us, myself included, have experienced bouts of plantar fasciitis. What is plantar fasciitis? Well, the itis, as we know, is an inflammatory process, and it really is an inflammation on the bottom of our foot, the sole of our foot. The tight plantar fascia is a very tight ligament that supports the arch. It contributes to the arch of our foot. It comes and attaches to the heel of the foot. You may have seen a foot model, an orthotic that can go into the shoe, gets beneath the sole of the foot, and that's because we're trying to support. That inflammation is very tender, perhaps most commonly first thing in the morning. Getting out of the car after a long car ride, putting that foot down, first step, extremely painful. And again, for you folks who've experienced this painful foot problem, you know what I'm talking about. But we commonly treat this disorder in a multidisciplinary process. Here at Maragal Medical, we look at more innovative ways as well as standard ways to take care of plantar fasciitis. What can we do? Think about what causes and what results in the ways in which we get people back in the order of feeling better. There's a number of things. Well, first of all, what causes it? If you have a little leg length discrepancy, if you're walking around in an unsupported shoe, probably the most common problem that causes the condition. If you start running, if you start doing different activities standing on your feet, you may cause an inflammation, and it really just becomes out of hand. It gets ahead of us, and it may take several months for it to settle down unless there's more active treatment. So let's think about what you could do to help out yourself. Well, we can do some stretching. You may have been told, well, if you just put some ice on the bottom of your foot, you may feel better. And that's very true. But what caused it in the first place? We think about the falling arches. We think about placing an orthotic. You may have seen an insert or custom-made orthotic as we make here. That gives support to the arch, gives a better support such that we are going to insert this in to the person's shoe and make that supportive structure a way in which we can minimize the recurrence or get ahead of it so it doesn't keep on promoting itself. If we think about walking around barefoot or that flip-flop unsupported shoe, we want to correct that. We may do some chiropractic adjustment to get the leg length differences back in order, or maybe the mechanics of your activities at work, standing or sitting, and get sit to stand positions a little bit better. And of course, exercise. We want to strengthen the heel, the calf, the shin, all the muscles of the lower extremity. All important things to maintain that aspect integrity. If you think about stretching, well, what are we stretching? We're stretching the calf and the Achilles, the heel cord. If you're very tight, that promotes your potential to get this painful condition. So we want to make sure that we're identifying with you what your causes are and then what else can we do. We've had great success in using a class 4 laser, a way in which we get treatment to that inflamed tissue by using laser on a number of sessions to help out getting the range of motion improved. And there's more and more study suggesting things like platelet-rich plasma or innovative ways to inject into that tissue that's not cortisone that could cause more destruction or potential lead to more injury. So we use platelet-rich plasma as the science is starting to show that we can get significant improvement in reducing the inflammation and improving your plantar fascia. Don't keep on walking on it. It's going to take several months for it to settle down. Let us help you get over this condition, especially as the summer comes into play and we're going to get back out a little bit more active, hopefully keeping you more physically fit. Give us a call. We'll see you soon.
That was great information, Dr. Marciello. I think you all now have a better understanding of what plantar fasciitis is and the different treatment options that we have here at Maragal Medical to treat plantar fasciitis. One of the keys is to make sure if you're suffering with plantar fasciitis, we can get your pain under control, and we always use a holistic approach. But the other key component is making sure that you have the appropriate support, and we utilize a cutting-edge technology with foot levelers based out of Virginia. They use a laser scan to make sure the accuracy of the measurement for the orthotic is going to be custom. There's 16 different measurements that go into making the orthotic. And the best thing about it, these orthotics are guaranteed to work and break in really nicely. If you have any questions or would like more information about the treatment options for plantar fasciitis, please visit our website, maragalmedical.com, and contact the office. And if you'd like to see more information just like you saw today regarding the clinic, please subscribe to our YouTube channel. Remember folks, your health is your best asset, and you should be able to access that asset each and every day without limitation. Let the doctors at Maragal Medical lead you to a path towards wellness. Well, that's it for today. I hope you enjoy this lovely weekend. Have a great day, everyone.